Hey everyone, Dr. Mike here. Before we dive into today's topic, let's start with a quick quiz. Can you identify which of these symptoms might indicate anemia in children? Is it A, fatigue, B, pale skin, C, shortness of breath, or D, all of the above? If you guessed D, you're on the right track. Anemia is more common in children than many parents realize. It's a condition where the body doesn't have enough healthy red blood cells to carry adequate oxygen to the body's tissues. This can lead to a variety of symptoms that can sometimes be mistaken for other health issues. Today we're going to explore the signs and symptoms of anemia in children, the causes, how it's diagnosed and treated, and most importantly, how you can prevent it. So if you're a parent, caregiver, or someone who works with children, this video is for you. Stay tuned because understanding anemia is crucial for ensuring your child's health and well-being. Let's get started. Anemia can manifest in various ways, and it's essential to recognize these signs early. One of the most common symptoms is fatigue. If your child is unusually tired or seems to lack energy, it might be more than just needing a good night's sleep. Fatigue in anemia occurs because the body's tissues aren't getting enough oxygen. Another telltale sign is pale skin. This happens because red blood cells give blood its color, and fewer red blood cells mean paler skin. You might notice this paleness not just on the face but also on the inner side of the eyelids, gums, and even nails. Shortness of breath is another symptom to watch out for. If your child seems to be out of breath after minimal exertion, it could be a sign of anemia. This happens because the body is trying to compensate for the lack of oxygen by increasing the breathing rate. Irritability and mood swings can also be linked to anemia. When children don't feel well, they can become more irritable. This is often overlooked as just a phase or typical child behavior, but it's worth considering anemia as a potential cause. Headaches and dizziness are also common symptoms. If your child frequently complains of headaches or seems dizzy, it could be due to reduced oxygen supply to the brain. These symptoms can significantly impact a child's ability to concentrate and perform well in school. Cold hands and feet are another indicator. Poor circulation due to anemia can make extremities feel colder than usual. If your child often complains about cold hands or feet, it's something to keep an eye on. Lastly, pay attention to your child's growth and development. Anemia can affect a child's growth rate and overall development. If your child isn't growing as expected, it might be worth discussing with your pediatrician. Anemia in children can be caused by several factors. One of the most common causes is iron deficiency. Iron is a crucial component of hemoglobin, the protein in red blood cells that carries oxygen. Without enough iron, the body can't produce enough healthy red blood cells. Vitamin deficiencies are another significant cause. Vitamins like B12 and folate are essential for red blood cell production. A lack of these vitamins can lead to anemia. This is why a balanced diet is so important for children's health. Chronic diseases can also lead to anemia. Conditions like kidney disease, cancer, or chronic infections can interfere with red blood cell production. If your child has a chronic illness, it's essential to monitor their blood health regularly. Genetic disorders, such as sickle cell anemia or thalassemia, are inherited conditions that affect the red blood cells. These disorders can cause severe anemia and require specialized care and treatment. Blood loss is another cause of anemia. This can be due to heavy menstrual periods in teenage girls, gastrointestinal bleeding, or injuries. Even minor but chronic blood loss can lead to anemia over time. Infections can also contribute to anemia. Certain infections can affect the bone marrow, where red blood cells are produced, leading to reduced red blood cell production. Lastly, dietary habits play a crucial role. Children who are picky eaters or follow restrictive diets may not get enough iron and vitamins from their food. This can lead to nutritional deficiencies and anemia. Understanding these causes can help in taking preventive measures and seeking timely medical advice. Chapter 3. Diagnosis and Treatment. If you suspect your child has anemia, it's important to see a doctor. The first step in diagnosing anemia is a complete blood count, or CBC test. This test measures the levels of different blood cells, including red blood cells, and can indicate if your child is anemic. In addition to the CBC, your doctor might recommend other tests to determine the cause of anemia. These could include tests for iron levels, vitamin B12 and folate levels, and tests for chronic diseases or genetic disorders. Once anemia is diagnosed, the treatment plan will depend on the underlying cause. For iron deficiency anemia, iron supplements are usually prescribed. These supplements can help replenish iron stores and improve red blood cell production. Dietary changes are also essential. Incorporating iron-rich foods like lean meats, beans, and leafy green vegetables can help boost iron levels. For vitamin deficiencies, supplements and dietary adjustments are recommended. If a chronic disease is causing anemia, treating the underlying condition is crucial. This might involve medications, lifestyle changes, or other therapies specific to the disease. For genetic disorders like sickle cell anemia, treatment is more complex. It may include medications to manage symptoms, blood transfusions, and sometimes bone marrow transplants. These treatments require close monitoring by a specialist. In cases of blood loss, identifying and treating the source of bleeding is essential. This might involve medications, surgical interventions, or other treatments depending on the cause of the blood loss. Regular follow-ups with your doctor are crucial to monitor your child's progress and adjust the treatment plan as needed. Anemia can be managed effectively with the right approach. Remember, early diagnosis and treatment are key to preventing complications and ensuring your child's health and well-being. Chapter 4. Prevention Tips. Preventing anemia starts with a healthy diet. Ensure your child's diet includes plenty of iron-rich foods. These include lean meats, poultry, fish, beans, lentils, tofu, and fortified cereals. Iron from animal sources is more easily absorbed by the body than iron from plant sources. Pairing iron-rich foods with vitamin C-rich foods can enhance iron absorption. Citrus fruits, strawberries, bell peppers, and broccoli are excellent sources of vitamin C. Including these in your child's meals can help improve iron absorption. Limit your child's intake of foods and drinks that can inhibit iron absorption. These include tea, coffee, and high-calcium foods like dairy products. While these are healthy in moderation, consuming them with iron-rich meals can reduce iron absorption. Ensure your child gets enough vitamins, particularly B12 and folate. These vitamins are crucial for red blood cell production. Foods rich in B12 include meat, dairy products, and fortified cereals. Folate can be found in leafy green vegetables, beans, and citrus fruits. Regular health checkups are essential. Routine blood tests can help detect anemia early, even before symptoms appear. This allows for timely intervention and treatment. Educate your child about the importance of a balanced diet and healthy eating habits. Encouraging them to try new foods and make healthy choices can set the foundation for good nutrition throughout their life. If your child has a chronic illness or a genetic disorder that increases the risk of anemia, work closely with your healthcare provider to manage their condition. Regular monitoring and appropriate treatment can help prevent anemia. Lastly, be mindful of your child's overall health and well-being. Ensure they get enough sleep, physical activity, and manage stress. A healthy lifestyle supports overall health and can help prevent conditions like anemia. By taking these preventive steps, you can help ensure your child stays healthy and free from anemia. Thank you for watching. I hope this video has provided you with valuable information about anemia in children. Remember, recognizing the signs and symptoms early can make a significant difference in your child's health. If you suspect your child might have anemia, don't hesitate to seek medical advice. Stay informed and take action early. Your child's health is in your hands. By ensuring they have a balanced diet, regular health checkups, and a healthy lifestyle, you can help prevent anemia and promote their overall well-being. If you found this video helpful, please give it a thumbs up and share it with other parents and caregivers. Don't forget to subscribe to our channel for more health tips and information. Thanks for watching and take care.